migraines and headaches can show up during the academic year for kids. So just overall, how often do we see headaches or migraines in kids? So headaches themselves are fairly common. When they do large-scale studies and send questionnaires out to families, when we look at kids around the age of 7 years old, we see that anywhere from 40 to 50% of kids will have presented or have complained about a headache at some point in their life. And by the time kids are in their teen years, so around 15 years old, anywhere from 60 to 80% of kids have had at least one significant headache. And then if you go specifically and look at migraine, the numbers also increase as kids get older. But even note there that kids as young as 3 or 4 years old can report headaches, 1 to 3% of the population. And as you increase in age up to teenage years, it's anywhere from 8 to 23%. So that's a fair number of kids that have headaches as part of their life, and certainly this can impact the school day and academic performance. So just briefly, although we're going to focus mostly on migraine, to also note that kids can get tension headaches, which are the milder forms of headaches that we see in children. Tension headaches are best described as headaches that last briefly, 30 minutes, typically, although they can go up to as long as 7 days. And their main identifying feature is that they're on the milder end. So these types of headaches are not the kind of headaches that are sending kids home from school, but they may send kids to the nurse. So they're mild or moderate at most in intensity. They're on both sides of the head. They tend to be more of a squeezing quality. It doesn't seem to be made worse by needing to, by running around or doing any kind of routine activity. And usually it does not have any of the other kind of features we think of with migraine. So there usually is not any stomach upset that goes with it, no nausea, no vomiting, and usually we don't see much light or sound sensitivity. So contrast that, and so when we look at how often tension headaches appear in children, there's a really wide variance. And so you can see there's a percentages that range anywhere from 1% of kids to have them to up to 70% of kids have them. So I don't know that that number is very helpful. But we do know that kids can start getting tension headaches as young as 7 years old, and that they often will have them a couple of times a month. So contrast that to migraines. So migraines in kids look a little bit different than migraines in adults. They typically are a little bit shorter lasting. So in adults, typically we say that migraines should last at least 4 hours. They can unfortunately last as long as 72 hours. However, in kids, they can last much more briefly, and so they can maybe only last an hour, and sometimes in some kids it's even less than that, like closer to 30 minutes. The headaches themselves tend to be more severe, and so that's one of the hallmarks of migraines, certainly in adults, but also in kids, their intensity level. These are stopping them from doing things. Oftentimes, if a child's in school and gets a migraine, they're definitely in the nurse's office, and oftentimes they'll have to be pulled out of school and go home. And then they have the more typical characteristics of having a pulsating nature. They're usually one-sided, although in kids, again, one of the differences is that their headaches are more likely, their migraine headaches are more likely to be on both sides of the head. And they will definitely get worse by routine activities. So having to get out of their seat, having to walk, having to go up and down stairs, definitely gym class or something like that can make it much worse. Also associated with these headaches are stomach symptoms like feeling sick to your stomach, and vomiting can unfortunately be part of it as well. And usually kids are light or sound sensitive, although they may not be able to describe this as well, but you can usually see it in their behavior, their way they're acting. And so what I want to focus on for just the next couple of minutes is why did we wind up seeing migraines? You know, how do they play a role during the school year? And oftentimes, and certainly in my practice, kids do really well over the summer, and we really get a really big uptick at this point in the year, coming the late fall, where the frequency of migraines really increase significantly. And so I thought this was a nice picture of why why potentially migraines happen more frequently during the school year. We know that migraines, there are going to be certain triggers, certain things that are happening in the environment that make migraines more likely to happen. On average, we say about each person that suffers with migraines has about 6 or 7 of their own personal triggers. So if someone keeps good track of their migraines, they often can identify these things. And so this was someone actually went around and asked a bunch of kids what they thought their common triggers were, and they made a chart of it. And so all the way over here on the left, you can see the things that make it more common for, more people have those things as triggers. And all the way over here on the right, these are also triggers, but they're certainly not as much as common. And so I will touch on a bunch of these things. I'm going to talk a little bit about stress levels, sleep levels, but I think some of the other things to note in here about potential triggers in the schoolroom or in the school environment. A big one I often hear are things like bright lights or fluorescent lights, which certainly can happen in school settings, but noise and excitation. I think this is one that maybe we don't talk about as much, but I have a lot of kids mention to me that places like the cafeteria or certainly kind of in between classes if kids are changing classes, but there's a lot of noise, a lot of excitation. That certainly is a trigger for a lot of children. And so that's something to note. Something we can certainly talk about, but I wasn't going to address specifically in these slides, is head trauma. So certainly concussions are becoming a hot topic, and so during the school year, kids are much more likely to be playing doing athletics, and so there's a higher rate of potential head trauma. And so the first thing I want to talk about was stress. So stress is the most common trigger for adults, for kids as well. And school can be stressful. And it's not just stress meaning that they've got a test tomorrow and so that they're really stressed about studying for that. Well, that certainly can do it. Just the everyday can certainly be stressful for children. The fact that they're, having to concentrate, sit still, pay attention for extended periods of time can be very stressful for kids. Kids that have underlying learning disabilities, school becomes a very stressful environment. And then in addition, the social interactions that go on in school can be an added stress. And so really asking your child about these things and really and having a good discussion about where potential sources of stress are can help identify ways to modify those stressors. Obviously, we can't eliminate stress from your child's life, unfortunately. That's not realistic. And so oftentimes first identifying it. So identifying that for some people, the first day back after a weekend, like a Monday, is really stressful because you go from kind of getting to do what you want to do to going back to class and having to sit. So if kids are having a lot of migraines on Sunday nights, it's helpful to talk through that and try to find out some workaround techniques to make those Monday transitions more easy. In addition, trying to identify if there are certain classes that kids are really getting very nervous about or very worked up about, then also addressing those are helpful as well. And then in addition, sometimes what I'll suggest to families or to kids are actually learning specific stress reduction techniques. These are great techniques to learn. The sooner you learn them, the better you'll be, because stress is not going to go away as you get older. And so there are things that I recommend if kids really do feel like stress is a big trigger and they're having a hard time getting a handle on it. The things that we've looked at that seem to be most effective include biofeedback. This is a technique, there's a picture of a girl down here who's doing biofeedback, where we use the body's natural signals, so things like your heart rate, your skin temperature, your muscle tension. We actually hook you up to the machine to show you those things. And then through a form of guided meditation, the person who's teaching you the biofeedback helps you change those measures. It's typically taught over, a couple weeks or a couple months. And so I think it's more concrete for kids as opposed to the second thing here, which is meditation, which also can be helpful. But sometimes meditation is a little abstract, especially for younger kids. And so I think the biofeedback often provides a physical or a visual response. Several biofeedback programs will actually use video game screens, which things kids are very familiar with. So that can be helpful. Meditation can be helpful, and there are meditations guided towards children. And then lastly, there is something called cognitive behavioral therapy, which is a form of therapy that you would do with a therapist. but it can be geared towards stress reduction and pain reduction. And so especially if there's a kid that does seem to be a little bit more anxious about testing situations or about school environments, this is something that can be helpful. So sleep is the other big thing, and school certainly messes up a lot of kids' sleep patterns, particularly as they get older. We know that sleep is important not just for quantity, but also for consistency. I put down here kind of the sleep requirements for children, and a lot of people are shocked more with the older ages. When you look at kids, so more school-age kids, these are 5 or 10-year-olds, the recommended amount of sleep needed for 5 to 10-year-olds is 10 to 11 hours. And for teenagers, this is where I get a lot of eye rolling, but it actually is true, they need anywhere from 8.5 to 9 hours. And this is unfortunately a lot more than what a lot of teenagers are getting and what even younger kids are getting. And so I really believe very strongly in enforcing this. In making sleep a huge priority, coming right after getting up and going to school. And so I think that this is something that when we really can get kids to adhere to this, makes a huge difference in their migraine frequency. And then in addition to getting enough sleep, we also think it's important to see regular sleep patterns as well. And this is where, again, it can be, during the school year, can be difficult. The idea is to have the same bedtime and the same wake-up time, and this includes weekends. And again, this is much harder for the teenage patients who like to sleep in on weekends. But it really does make a difference if you have a bedtime and you really try to stick to it. Number one, it helps you fall asleep more easily, but also number two, that consistency does seem to do something to help control migraine frequency. There are patients that will get oversleeping migraines, so they sleep too late on a Saturday or Sunday, and that triggers their migraine. My caveat for teenage patients is that on weekends, they have to still get up the same time they do during the week, but and I usually tell them to have a snack or drink some water, and then I tell them to go back. They can go back to sleep and do their next, another 3 hours or whatever else they need to do to make up on the weekends. So another big thing that we see frequently is missed meals. In an effort to get out of the door in the morning, a lot of kids will skip breakfast, and you can see here these number of school-age kids between 8 to 12% will skip breakfast, and by the time they get to adolescence, 20 to 30% will skip breakfast. It's a huge number of kids, and we know, especially in migraineurs will know this, that going a long period of time without eating something definitely can be a trigger. And if you think the kids have gone all the way overnight without eating, and then they wake up and they still don't eat anything, and they don't eat anything till lunch, that can be a huge trigger. And there's also a fair number of kids that will skip lunch as well, usually related to the quality of the lunch, that they don't like what's served in the cafeteria, and so they wind up eating some pretzels or not eating anything at all until they leave the school day. And so I spend, again, a lot of time kind of really coming up with where the issues are. Is it a timing thing in the morning? You don't have enough time to get your breakfast? Okay, so we need to get some stuff that's portable, stuff that you store in the car, stuff that you take on the bus, stuff that you can eat. High quality, you want things that are high in protein, complex carbohydrates, but things that are really portable. And so we can't use that excuse anymore that I didn't have enough time, because there has to be some transit time on the way to school, and you can definitely fit something in that time period. And then for lunch, there should always be a backup plan. So if they don't like the lunch, that they know that they can have their yogurt or their granola bar again, or their handful of nuts if the school will allow it, that will give them something to make up. And I let kids, take stuff in their backpack, put it in their lockers. I write notes every day to allow kids to be able to bring their snacks into school. And so again, it's really about finding the things that your child will eat as a kind of a backup plan. And then, sorry, this one's a little blurry, but one of the other things I want to talk about was hydration. Certainly dehydration can be a big trigger for a lot of kids. And again, if they, some kids have an issue because they don't like going to the bathroom in school, and other kids just, some kids aren't allowed to bring water bottles to school, so they really aren't drinking a lot of water. Again, the requirements for liquids at different ages, is variable. And these numbers are based on what you need from food and water. Usually what I tell people is that you need about an extra liter a day, depending on your age of fluid. And I think, again, this is something where you want to set a concrete plan. So the best idea usually is to get a water bottle that's of the total amount that you want to drink in the day, fill it up once in the morning, and know that it has to be gone by the end of the day. I have some patients that don't like drinking water kind of sips throughout the day, and they'd rather just kind of sit down at once and drink it all, and that's okay too. So as long as the bottle's empty by the end of the day, we're happy. And so moving on a little bit to how do you manage migraines in school, and I think that the important thing is to kind of have emergency backup plans in place, and hopefully you don't really have to use them. So again, those with migraines know that the most effective way to treat a migraine is to treat it really early, so to catch it right at the beginning of an attack. And the difficulty, I think, often in school is that kids either don't want to leave the class or are embarrassed to raise their hand and to leave the class and go to the nurse, or actually they're told that they can't leave the class until some teaching period is over. And so I spend a lot of time with families as well as with teachers instructing them on the importance of treating headaches early. And so the kids need to be very, oftentimes a discussion should be had at the beginning of the school year. My child has migraines. When they have a migraine, they know. When they have a migraine, they need to go right away to the nurse to take their medicine. And so there can be some kind of signal set up between the child and the teacher, and when that signal happens, it's understood that that child can go right away to the nurse. And then also in the second hand, in the nurse's office, some nurses will try some more alternative methods, resting in a dark place, having some water to try to treat a migraine. And for some kids that works, but for other kids with really severe migraines, that waiting doesn't help. And so we'll write to the nurse that it's really important that the child get their medication as soon as they walk in the door. And then they can do their resting and water drinking after they've taken the medicine. The next thing is it's important to have the medicine that works, so to try to figure out which medicine works best for your child, and then to make sure that the nurse has it on hand and understands when to give it. And so oftentimes this requires, getting an extra prescription filled and having a note written to the nurse on when she should give it or he should give it. But I think it's very important that this gets set up, and then we can ensure adequate treatment. And the goal really is to return the child to class after being treated. Effective medicine generally should work within an hour if we're doing things right, 2 hours at the most. And so if the child can rest in the nurse's office for that period of time until they feel better, that would be great, that they're able to go back to class afterwards. And so again, I just think it's very important to have a discussion with the school nurse, have a discussion with the teachers at the beginning of the year and say, look, this is going to happen every once in a while. These are the things that we need to do to make sure that my child can be an active participant in the classroom. It's also important to mention that sometimes the migraines are severe enough that things like homework might not get done, or the child may need to miss a day of school or come late to a day of school. Again, kind of bringing this up in the beginning of the year is much more helpful than having to explain halfway through why there have been, 3 or 4 absences. Oftentimes, with some documentation from a physician, this becomes much easier as the school year goes on if there's any questions. And then the last thing I just wanted to talk about briefly was what happens if your child is missing extended periods of school secondary to migraines. And so there are children, unfortunately, whose migraines are very, very frequent, and or when they come, they last for more than a day or two. They may last for 3 or 4 days, and they may wind up missing school for longer than anyone would like. I think in the short term, oftentimes what we request is that the school try to be as understanding as possible, try to minimize makeup work, because oftentimes what happens is if you miss 3 or 4 days of school, you're then 3 or 4 days behind with your work, and then your stress level goes through the roof because you've now got to make all this work up. So we try to ease the makeup workload and try to have it take care of over the next several weeks. There are children that have even more frequent migraines and miss extended periods of time, and we often have discussions about home instruction and getting pulled out of school. Generally, when we've looked at this from a kind of a scientific standpoint, it really does not look like home instruction or pulling kids out of school is beneficial in any way. It seems to, not only does it isolate the child, but the child falls back as far as education, because typically home instruction programs are only a couple hours a day at most. And so we really try everything we can do to avoid this situation and to allow modifications in the school day to allow a child to continue to attend school as opposed to kind of go under home instruction. So that's what I have for slides. I'm more than happy to talk to you about questions or answer anything else that you have.
Thank you. Our first question, thank you so much for touching on the sleep aspect of migraine. As a family with the history of sleep apnea, I've noticed that my children do wake up a little bit tired after sleeping. Would you recommend a sleep study?
That's actually a great point. And when we have looked at children that have migraines, they actually do seem to be at a slightly higher rate, have a risk of having sleep-disordered breathing or sleep apnea. So certainly if your children are complaining that they're waking up frequently or that they feel like their sleep is not restful, particularly if you hear them snoring a lot, I will usually recommend a sleep study at some point, because that's something that can be very easily addressed and can make a big difference in their migraine control as well as their general health.
Thank you. Our next question comes from Mia. As a pediatric physician, would you recommend acupuncture for children under the age of 11?
I think it's very child dependent. I do have some younger patients that are able to do acupuncture, and acupuncture we do think is one of the alternative methods that can be helpful. And so I usually leave it up to the number one, up to the family and the child, and if they feel comfortable with the idea, there are a couple of acupuncturists that will do young children. The other option, although this is sometimes harder to find, is that there is a type of acupuncture called laser acupuncture, which does not use actual needles. It uses lasers, safe lasers, to kind of use that over the standard acupuncture points, and that does seem to be something that has similar to effect to acupuncture. So that sometimes gets away around the needle problem.
Thank you. Are Botox treatments, are Botox injections safe for children?
So Botox, which is used for to treat chronic migraine, which is someone that has migraine 15 days or more out of the month, we know is effective for adult patients. We also, in a separate context, use Botox in children for other reasons, for other neurologic reasons. We have used Botox in children. And so the official recommendation is that it's not FDA approved, nor has it been formally studied in children. But I think that this is an area of interest because I think we do have safety data on it in children, and there is a potential that it could help them with their migraines as well. Yes.
Thank you. I noticed you spoke about advocating for your child in the school system. How do you come across as a parent that is truly concerned when you have requests to change the lighting in the classroom versus trying to make everything about your child? Yeah, that's true.
Right. I know. That's true. And that comes up with a lot of different things. I've also had, some kids are also very screen sensitive, and there's certainly a lot more smart boards and things that are used. And so sometimes trying to get them to, we'll have people print out things on paper, and you can meet a lot of resistance. So I typically, I think you have to, it kind of depends, I think, on how severe of a trigger it is for your child. So if your child really is very light sensitive and this seems to be a big issue, I think you push for it and you explain that, this was going to allow your child to focus focus better and to be present more. You know, I think things like lighting is a little bit more difficult because it kind of affects the entire classroom. And I do sometimes recommend sunglasses, even in